This is the Femmax set of dilators, which comes in this discreet case that looks a bit like a spectacle case. Inside are the set of dilators. When you get the dilators out, you will actually see the largest one first, which sometimes can alarm ladies. There are 4 dilators in the set, and they fit inside each other a bit like Russian dolls. They actually fit together in 2 pairs just by simply screwing them together. So that's the first set, and the second set go together exactly the same. Also in the case there are 2 samples of vaginal lubricant. When using the dilators, it's important to try and be as relaxed as you can. So try and make sure that you're not going to be disturbed, that you're in a private place, and also that you've got time to use the dilators. If you're rushing around, then you're probably going to feel quite stressed, and this isn't the ideal time to use the dilators. Some ladies find that having a nice relaxing bath beforehand can help their relaxation. A variety of positions can be used to use the dilators. Most ladies prefer lying on their back on their bed and then bringing their knees up slightly apart and inserting the dilator into the vagina that way. Other ladies though can use a squatting position, or some ladies prefer to put one leg on a chair or the bed and dilate that way. It is really important to use some kind of vaginal lubricant when using the dilators. This lubricant should be water soluble, and a small amount should be put on the end of the dilator and also just into the vagina by using your fingers. A lot of ladies worry that they're going to cause some damage by using dilators, but as long as you use a firm but gentle pressure when inserting the dilator and just insert it as far as it will go into the vagina and don't try and push or force it, then everything will be fine. If you've had radiotherapy, once you've inserted the dilator, it is important that you move the dilator in the vagina from side to side and also forwards and backwards. The idea of this is to try and stop any scar tissue forming within the vagina. As you can see, there are 4 sizes of dilators. We would advise you to start with the smallest dilator and then gradually progress through the sizes as you feel ready. Normally each dilator is inserted for 5 to 10 minutes at a time. Some ladies do experience a very small amount of vaginal bleeding after using the dilators. If this happens, don't panic. If, however, the bleeding becomes heavy, or if you notice any vaginal bleeding at times when you haven't been using the dilator, then please consult a health professional. To clean your vaginal dilators after each use, they need to be washed in warm soapy water and then dried thoroughly, and then they can be stacked inside each other for storage. You will be advised how often to use the dilators by your health professional, and the dilators can also be used in conjunction with having intercourse.